I want to say to the common man is that if there is a pulmonary problem which is lingering, or which there is a reason to believe that it's not getting sorted, or needs to be sorted out, or there are chronic symptoms which are lingering, I think it's worthwhile to get it assessed in detail, because for any problem, any disease, I think the diagnosis is the most important thing. And I think with specialization, what has happened is we are able to focus more and more on the diagnosis, refining the diagnosis, to the best possible manner, so that once that's clear, then you know how to approach that particular patient. So the common man, I'll say a lot of progress has happened in pulmonology, maybe at asthma, COPD, interstitial lung disease, pulmonary endoscopy, lung cancer, sleep apnea, any pleural disease like a pleural effusion, etc. I think we've made good progress, and I believe that in the next couple of decades, we'll see further much more progress in this field.
Welcome to 23rd episode of Arogyam Katta. Today we are going to discuss about pulmonology, and our faculty is Dr. Prashant Chhajed, an eminent pulmonologist in Mumbai. Welcome, doctor, on the Arogyam Katta. Before I start, can I know what is pulmonologist? What do you do?
So I think that's a very good basic question, I think, and I think it's a good start we've made. So pulmonologist means it is related to the lungs. So a doctor who is specialized and dealing with lung related diseases is called a pulmonologist. Like for a heart disease, you have a cardiologist. For the brain, you have the neurologist. For the lungs, it's a pulmonologist. So what are the spectrum
Scope.
or the scope of problems that are covered by a pulmonologist? So the spectrum of diseases which are covered by a pulmonologist include from allergies, that is asthma, allergic rhinitis, then a common condition called COPD, which is chronic obstructive pulmonary disease, often linked, it is dominantly linked to smoking, and now pollution is also a great contributor for it. The other conditions include lung infections like a pneumonia, like tuberculosis or fungal infections, COVID-19 for that matter, where pulmonologists played a big role. Yes, and influenza, the common viral pneumonias. So that is the infective spectrum that is dealt by the pulmonologist. Then you have lung cancer, or what we call as pulmonary care in oncology. That is a broader aspect of dealing with tumors in the lung, where you are dealing with tumors of the lung per se, primary, which is the lung cancer, and then you are also dealing with cancer from other parts of the body which have migrated to the lung.
I see. So secondaries are developed
in the lung. Then the another big component which is also recognized more and more in the last couple of decades is interstitial lung disease. Now, interstitial lung disease is a broad category of diseases. There are various subtypes to it. So those are the disease also that is dealt by the pulmonologist. Then the other is embolism, blood clots in the lung. So blood clots in the lungs are not uncommon. Often there is a delay in diagnosis. Again, in COVID-19, we saw lots of patients who had clots in the lungs, so people have the awareness. Then another important aspect is sleep apnea. Yeah. So sleep apnea is obstructive sleep apnea is the word, and the broader terminology for this is sleep related breathing disorders. So all the breathing disorders that are happening in sleep come under this umbrella. Then you can expand it further to intensive care. In the intensive care, lung infections, or mechanical ventilation, what we call as artificial ventilation, which is given to the patients, that is the domain also where pulmonologists are contributing in a big way. And another important thing I would say is, which is developing well in the last couple of decades, is non-invasive ventilation. So people who have chronic respiratory failure, these patients are quite efficiently managed with non-invasive ventilation, which can be also in the ICU, called as ICU NIV, or NIV at home. So, I mean, these are some of the examples where which diseases or the spectrum or the scope of pulmonology is there.
Now, you have detailed a lot of lung diseases. Which is the most common that you come across?
So, one very important aspect, actually, I would like to add to the previous question which you asked, is about the scope of pulmonology, which, in this enumeration, I don't want to miss out, are pulmonary interventions. Pulmonary interventions forms a big subspecialty for pulmonology, and that includes endoscopy of the airway and endoscopy of the pleura. Pleura is the covering which is present on the lung. So the endoscopy of the airway is called bronchoscopy. So bronchoscopy is used to diagnose lung infections, is used to diagnose lung cancer, it's used in the ICU to remove mucus plugs. It's also used as a conduit to approach mediastinal lymph nodes, which we call as EBUS TBNA, that is endobronchial ultrasound TBNA. And then pulmonary interventions are also an important modality in managing airway stenosis. Like if in the heart you have coronary artery stenosis that is treated with angioplasty. You have airway stenosis, which may be treated with tracheoplasty or bronchoplasty. You have tumors in the airway, which can be removed using bronchoscopic techniques. You can have stents, which are put in the airway, and this is also included in the pulmonologist scope. And lastly, as far as the intervention is concerned, we talk about pleuroscopy. Pleuroscopy is introducing a pleuroscope into the pleural cavity, and typically we use this technique for undiagnosed pleural effusions where there is fluid collection in the pleura. So that is something that is also within the domain of pulmonologist.
Now, how does one get to know that, yes, I'm having a lung issue, or what are the common symptoms that one should be watchful to know that he is heading for a problem? Because many times what happens is, like, there are symptoms like heart attack, chest pain is there, or something happens. So now suppose if my lung quality is deteriorating, how do I get to know?
So there are common symptoms, very few. One symptom, if there is a prolonged cough, then yes, you can think about a lung problem. The another thing is, now, as you mentioned, chest pain. Chest pain can be because of a cardiac problem, or it can be because of a lung problem, a pneumonia, or an embolism. There can be many reasons why you can get a chest pain. So whenever there is an individual who has chest pain, you have to think either it can be cardiac or it can be a lung related thing. Another symptom which is common, or where one can think about a pulmonary problem, is breathlessness. Now, breathlessness can be at rest when you're sitting, or it can be on exertion. Now, again, the common causes of breathlessness can be a lung problem, or it can be a cardiac problem. Yes. Another important symptom that one can look for is coughing out of blood. If you're coughing out blood, then there's a very good chance that there is a lung problem. Another thing is fever. If you have a fever which is combined with a cough or a breathing difficulty, then that's quite likely that you're dealing with a lung infection.
Now, does lifestyle has any role to play in the quality of lung or whatever? I mean, in lung disease.
Yeah.
So like smoking, late night parties, I mean, all this modern lifestyle which is happening.
So your question
Does
is,
it?
what are the lifestyle issues that may impact lung health?
Correct, correct,
Yeah.
correct.
So you actually mentioned it. So smoking, vaping, then the hookahs, whatever, these are all modalities which can cause insult to the lung. Okay, so these are lifestyle issues, celebrations, if you may call it, or whatever it is, or addictions. These can influence the lung. What are the other lifestyle things that can affect the lung? I mean, it's an overlap. I think increased body weight.
Okay.
Obesity can have a big impact on the
On
lung,
the lungs.
because obesity, if the individual has a lot of truncal obesity, a central obesity, that can inhibit the complete expansion of the lung. Then that is also linked to sleep apnea and other things. Another problem with the current lifestyle, where movement is a little bit less, exercise is a little bit less, we are eating a little bit more, again linked to obesities. If there is a lung problem, that lung problem will always be exaggerated in the individuals who have obesity.
Obviously.
Another problem of lifestyle would be eating late night. And sometimes it's a problem. I think you can party and eat late night, or it can be an urban problem where people are traveling the whole day, reach home late, have dinner, and then go back to sleep. So if that can also trigger what is called as acid peptic symptom, it's a correlation between the lung and the gut health. And these individuals, if they have acid reflux, that can also be a common reason for the cough.
Okay, so acidity and lung issues
They are linked.
are not completely separate. They are linked together.
Yes, to a certain extent,
To an
yes.
extent. Now, how does one maintain a good quality of lungs, or how do I maintain my lungs healthy?
So I think it's a bit related to the previous point that we
Yeah.
discussed. An important thing is to avoid any insult to the lung. So
Any?
insult
Okay,
to the
okay.
lung. So it's a clear-cut no as far as the smoking, vaping, tobacco, or any other form of
Tobacco.
inhaled addictions are concerned. I think it's a complete no. I think that would play a very important role as far as lung health is concerned.
Mhm.
The other thing is now lung health for healthy individuals, and then you have a lung health for elderly individuals, lung health for individuals who are immunosuppressed for whatever reason. They may have a chronic disease, they may be on some steroids for whatever reason, they may be on immunosuppressive agents. So very important things for this group of individuals are vaccinations. So
Okay.
so there are a lot of vaccinations available also in the adult, because typically what happens, whenever we think about vaccines, we're thinking
Child.
about child vaccines.
Child.
Now we have an adult vaccine. So I think it's very important to discuss with your healthcare provider about influenza vaccination, pneumococcal vaccination, shingles vaccinations. These are vaccinations which have been shown to have a very good impact and can help a good quality of life. Otherwise, just imagine somebody getting a herpes zoster and having a post-herpetic neuralgia. That individuals can get affected in a bad way. So this is from how you can maintain good health. One important point I also want to say is individuals who are immune suppressed, they must also be very careful about coming in contact with individuals who are having fever or other things, and immune suppressed individuals, whenever they are visiting crowded areas or visiting healthcare facilities, it's worthwhile to use a mask. So these are some of the tips, I would say, or some of the points which can be adopted for a good lung health.
Has COVID impacted on the number of cases of lung issues?
So COVID did have a big impact on the lung. I think we are all aware of it, and that was the acute problem. So COVID would cause COVID pneumonia, which was very common, and the other thing that also COVID caused or influenced are blood clots in the lung. The other thing that COVID also, patients with severe COVID, they also landed with some element of lung fibrosis, and we were worried, that so many people getting COVID-related lung fibrosis, how it would span out, how would these individuals have the future, issues, lung issues related in their life. So what we found is that in COVID, Those who recovered have recovered well. We have had patients who had chronic lung symptoms or long COVID symptoms. I'll focus on the lung issues. And there were individuals with a lot of patches which were present on the CT scans, had cough, breathlessness for prolonged periods. But what we found eventually is in most of the individuals who we followed up after 6 months, year and a half, they seem to have recovered. And those who have recovered have landed with very minimal to no scarring in the lung. Of course, there are certain individuals who might have had a lung fibrosis in the past. They may have had a slightly exaggeration in the lung fibrosis, but we will actually truly know about the long-term impact of COVID only in the time to come when we have systemic data which is published.
What is lung fibrosis you are talking about? What does it mean?
So lung fibrosis is like a scar in the lung.
Okay.
Now the causes of the scar in the lung can be varied.
Infinite.
So I'll discuss the common ones with you. If somebody gets a lung infection, say pneumonia, the pneumonia could just clear up very easily. And you could not be able to find any residue or a sequelae, whether this individual ever had a pneumonia. And there are some individuals who will recover, but will recover with some scarring. It's like somebody having an injury. In some people, the injury recovers and you never know if there was an injury on the skin. And there are some individual like myself, had a crack burn here and then the scar remains. So in some individuals, you can have a scar related to infections. So you can have a post-pneumonia scar. You can also have post-tuberculosis. Tuberculosis is a very common reason of having scars in the lung. So that's a fibrotic scar. Okay. Then the other fibrosis, which I mentioned to you, we are recognizing more and more, is interstitial lung disease.
Okay.
Interstitial lung disease, as I said, is a big group of diseases. There is inflammation, there is swelling in the lung, and in several of these patients or these individuals, the swelling can eventually lead to fibrosis. And this fibrosis, unfortunately, in majority of the cases is progressive unless you treat them to slow it down. And in a very few of these individuals, you can have an ILD, which was because of certain exposures, one-time insult, and then you remove the insult, you remove the exposure, and then these individuals have a static ILD, which may not even need to be
deteriorate further.
Yes. And of course, the other group of individuals would need treatment for inflammation or for fibrosis. You may need antifibrotics to slow down the progress.
What's the difference between asthma and bronchitis? Because these are the two common words all of us hear.
Well,
but we don't know the difference between the two.
So let me start with what bronchitis means. Bronchi are breathing tubes in the lung. So, we have our voice box here. Voice box, below the voice box, we have the airway. That is called the trachea. The trachea divides into the right bronchus, left bronchus. So any inflammation in the breathing tubes is referred to as bronchitis. Inflammation. Now, this inflammation can be multifold. You can have inflammation, you can have infective bronchitis, or you can have allergic bronchitis. So, if you have an infection, you treat the infection, the inflammation is taken care of, and the bronchitis settles down.
I see.
Okay. Then you have inflammatory bronchitis. Say, example, allergic bronchitis. So, allergic bronchitis is also asthma, referred to asthma. So, if that allergic bronchitis fulfills certain criteria, most of the time it is asthma. So, asthma is a form of allergic bronchitis.
Okay. It's a form of
this
thing. What is COPD?
Very good. So, in asthma, there is allergic bronchitis. If you treat it, if you diagnose it and you treat it optimally, and if individuals continue to take the treatment optimally, then asthma is a reversible form of bronchitis or airway obstruction. So what happens in bronchitis? There is a swelling in the bronchi because of the inflammation. The bronchi or the air tubes get narrowed, and that's what causes difficulty in breathing. The thing about asthma is when you treat these individuals with inhalers or appropriate therapy, the inflammation settles and the bronchi reverse to normal. Okay, so this is in asthma we say it is a reversible airway obstruction.
Okay.
And what is COPD? COPD is a chronic bronchitis. So what is chronic bronchitis? It's commonly seen in individuals who've had an history of smoking. So smoking leads to a continuous insult on the airway, causes inflammation, and eventually it causes bronchitis. The way it is different from asthma is this is non-reversible.
Okay.
There will be a small individuals who've got a reversible bronchitis like asthma and are smoking. They can have that reversible component, but otherwise the COPD is
one way,
non-reversible bronchitis. It's a one way, like you said.
One way.
So whenever we treat COPD, we are treating them to give them symptomatic relief, to reduce the flare-ups, and to slow down the progression of the bronchitis. Because in COPD, what happens is it can be smoking or air pollution or indoor pollution or wood fire exposed pollution. It triggers an inflammatory pathway which can actually be ongoing.
What made you interested in pulmonology? Because I'm sure there may be many options to you when you chose to become a pulmonologist.
Yeah.
What attracted you towards that?
So I'll tell you. I mean, this is this I've already discussed with my parents, and now you ask me this.
Okay.
So this when we were doing MBBS, we had 3 phases of MBBS. We had phase 1, phase 2, phase 3, 1.5 year each. So when I started the phase 2 of our MBBS, we go through various rotations. We go internal medicine, surgery, etc., etc. And my first rotation was internal medicine, and in internal medicine then you start picking up the different systems that respiratory, gastroenterology, infection, etc. And that's when I read respiratory and I got the inclination towards respiratory. Yes, I could have done internal medicine also, but then once I finished my MBBS, I had the option of doing internal medicine.
Yeah.
I could do pulmonary medicine, and then with some guidance from seniors, also from my parents, my father, I think eventually it occurred to me that actually I want to do pulmonary medicine. They helped me in that, and here we are.
That's where you are.
Yes.
Now you must be seeing hundreds and thousands of patients per year or continuously every day. Anything that you would like to advise people for as a pulmonologist? What would your message be to common man, whether sick or healthy?
So as far as pulmonology is concerned, I think all the subspecialties of medicine, whether it is pulmonology, cardiology, gastroenterology, neurology, all are part of internal medicine. Okay, then things have subspecialized into these system-related specialties. Pulmonology is relatively a new kid on the block. It's really been recognized very much in the last 20 years, I would say. There have been a huge amount of progress as far as the awareness of pulmonology is concerned, the research in pulmonology is concerned, and because there is a lot of scientific progress in a particular field, automatically it becomes that you need physicians, you need doctors who are focused and try to and do their best to be updated in that field, so that eventually you can translate the best possible medicine to the patient care. So that's what has happened in pulmonology. Last 2 decades has been an exponential growth as far as the scientific literature is concerned, our understanding is concerned. The modalities of treatment have evolved remarkably as far as pulmonology is concerned. The pulmonary interventions have evolved remarkably in the last 2 decades or so, and therefore I want to say to the common man is that if there is a pulmonary problem which is lingering, or which there is a reason to believe that it's not getting sorted, or needs to be sorted out, or there are chronic symptoms which are lingering, I think it's worthwhile to get it assessed in detail, because for any problem, any disease, I think the diagnosis is the most important thing. And I think with specialization, what has happened is we are able to focus more and more on the diagnosis, refining the diagnosis, to the best possible manner, so that once that's clear, then you know how to approach that particular patient. So the common man, I'll say a lot of progress has happened in pulmonology, maybe at asthma, COPD, uh, interstitial lung disease, pulmonary endoscopy, lung cancer, sleep apnea, any pleural disease like a pleural effusion, etc. I think we've made good progress, and I believe that in the next couple of decades, we'll see further much more progress in this field.
So thank you for coming on Arogyam Katta. Let's hope viewers are benefited by this lecture. And now I'll ask you for rapid fire round questions, answers of which will be either yes or no, or true or false.
Okay.
Okay. Smoking is the number one cause of lung damage.
Yes.
Lung cancer can happen even for non-smokers.
Yes.
Pollution can cause permanent damage to the lungs.
Yes.
Breathlessness is always related to heart problems.
No, breathlessness is related to, can be related to heart problems, lung problems, or any other systemic problems. It can be a kidney issue, it can be a diabetic issue. So breathlessness has multiple reasons. Within that, heart and lung are the commonest or at the foremost.
A persistent cough for more than 2 weeks should be investigated.
Definitely yes.
Asthma is a curable disease.
No, it's a controllable disease.
Steam inhalation can help in many breathing problems.
Not really.
COVID-19 can cause long-term lung issues.
COVID-19 did cause long-term issues, but most of the individuals have recovered within 6 to 12 months.
Lungs have natural ability to heal themselves.
To a large extent, yes, but does not mean that we should insult them with known causes of insult.
Oxygen therapy can be used at home.
Yes, it can be used at home, and it's a revolutionary treatment only for selected patients with a chronic lung disease such as interstitial lung disease or an advanced COPD.
Children can also suffer from asthma.
Yes, it's possible that children can also suffer from asthma, and children who are less than 5 years of age, we typically call it bronchial hyperreactivity.
Pulmonary TB is contagious.
Yes, it is.
COPD is fully reversible with treatment.
No, COPD is non-reversible. As I mentioned, asthma is reversible, and COPD symptoms can be controlled, quality of life can be improved, and the progression of COPD can be reduced with modern therapies, and also flare-ups can be reduced with modern therapies.
Passive smoking is equally harmful.
Yes, it is.
Lungs can be affected by obesity.
Yes.
Breathing exercises like pranayama helps for lung health.
Yes, I think breathing exercises, it may be yoga exercises or exercises recommended by a physiotherapist. All of these have a good influence on the lung health.
Vaccines can help prevent lung infection.
Yes, vaccines, adult vaccinations for that matter, play a very important role in the elderly and those having chronic lung disease.
Sleep apnea is a lung disease.
Yes, as I said, it comes under the umbrella of sleep-related breathing disorders.
People living in big cities, are they at more risk than the one who are living in villages?
People living in the urban areas definitely have a higher risk of getting a lung problem, and that is because of exposure to the pollution, and the pollution levels, as we are all aware, are very high in the urban cities. Individuals who are living in the village areas have a chance of having a better lung health. However, I must say that individuals who are exposed to chula fume exposure, where the chulas are used to cook food and there is not adequate ventilation in the home, is also a known cause of a chronic lung disease, or we would say is as a chula fume exposure related COPD.
Regular walking improves lung capacity.
Regular walking has a lot of health benefits, including having a better lung capacity.
I wanted you to talk for 1 minute to the younger crowd that lung diseases happen at the older age or at an advanced stage. So if you want to have a peaceful, good old age, probably you need to start working with basic, simple rule.
Absolutely.
I'm just asking you to give a kind of small talk.
Yeah. So, as far as the advice to the young generation would be, one should avoid all matters or habits or choices that can have a bad lung influence. And off the shelf, it comes to smoking, vaping, drugs which are inhaled in any form. So you have to avoid this. That includes also, I would say, hookahs also.
Regular exercises.
Yes, so these are the things to be avoided. Regular exercise not only has a benefit as far as lung health is concerned, we know that it is overall important for health, good health. So I told you to avoid lung insult. The second thing I would say is, if one identifies or one has any symptoms of any lung related problems that I discussed earlier, one should not prolong them. One should go for the correct diagnosis, and if required, there are certain ailments such as asthma or bronchitis which can be treated, and if you treat them initially, in the long term you can maintain good health and a good lung capacity. Yeah, so I think
so. In short nutshell, if you want to have a good old age, then probably you have to start working when you are young.
Yes, I think yes, you have to start working when you are young, and if there are any again, avoid bad habits, maintain a good health routine, and exercise regularly, have a good diet, have a good sleep. I would say avoid obesity, and maintain good muscle strength. See, it's very important. The longevity in our country is also increasing. So, if our longevity is increasing, then it is extremely important that we maintain good health so that we are able to enjoy the longevity.
Does mental has any role to play? I mean, I'm asking few additional questions because when I was talking with you, say tensions or stress or any other kind of form of sorrows which can impact on the lung health.
Yes, so stress, sorrows, grief, having multiple issues, multiple tasking, these can, if they go beyond a certain limit, they can cause several problems. The common is anxiety and panic. Okay. The third other thing we must realize is, we talk about asthma as an allergic disease. Okay. So allergic bronchitis, but mental stress, emotional extreme, emotional disturbance is also a trigger for asthma.
Thank you very much, and thank you for coming on Arogyam Katta.
Thank you very much for inviting me. Thank you very much.
अगर आपको ये वीडियो पसंद आया हो तो चैनल को सब्सक्राइब करें और लाइक करना ना भूलें। अगर आप किसी विषय पर और जानकारी चाहते हैं तो कमेंट में लिखें ताकि हम आपकी पसंद की वीडियो बना सकें।